What's the best treatment option for TMJ syndrome? I definitely think one of the best treatment options is prolotherapy. There definitely are times where somebody needs splints. So if a person opens and closes their mouth and they always hit first on the right side of their teeth, the teeth especially in the back, and they just have right-sided TMJ, yeah. You might need some bite equilibration, so you go to a dentist that does bite equilibration. So, bite equilibration, splinting, it does play a role in the treatment of TMJ, but we've had lots and lots of patients where all we did was prolotherapy because by definition, the TMJ problem, it's within the TMJ joint. And there probably science will show that it might be that the TMJ problem starts first, and then that leads to the bite problem. So in other words, how come folks who get prolotherapy, then their bite is fine? Without bite equilibration, so the point is TMJ syndrome, it is multifactorial. So I always think it's good first to start with prolotherapy because it's simple. And honestly, it's a lot less expensive than a lot of splinting and complicated dentistry. Some of the times I talk to folks, they've spent tens of thousands of dollars on their mouth. So I think a much simpler approach is just try some prolotherapy. There's a ligament called the TMJ ligament, which attaches to the disc. So there is a disc in the temporomandibular joint. So there's a disc, there's ligaments, there's obviously muscle attachments, there's a nerve supply. So all those things can be treated with prolotherapy. And the other thing too with prolotherapy, it's just very simple in the TMJ. It's a very superficial joint. Typically, a person would get anywhere from 4 to 6 injections at one time. The injections just take a few seconds. Normally, I would see somebody about once a month, once every 4 to 6 weeks. Normally, it just takes 3 to 6 visits. And if they weren't recovering quickly, or the prolotherapy just seems like it plateaued, then of course I might send them to a dentist. I work with a local dentist here who's spectacular for bite equilibration, but often a person just needs prolotherapy.